A broad family of viruses that are actually named after their microscopic appearance. A corona looks like a crown. And there are, again, dozens of these. There's a few of them that are known to infect humans that largely cause relatively mild upper respiratory disease or common cold. And then more recently, we've had outbreaks of coronaviruses that can cause severe lower respiratory tract disease or pneumonia. So the first of these that we became acquainted with, you might remember, or your viewers might remember, SARS. That also came out of China back in 2003. More recently, we've had MERS, which is known as the Mideast Respiratory Syndrome virus, which is coming out of the Arabian Peninsula. So now this is the third kind of novel coronavirus that we're having experience with that can cause severe lower respiratory tract disease. These typically spread from person to person via large droplets, respiratory droplets. So when somebody coughs or sneezes, it can be transmissible that way.
There were reports that this started at a food market. It is not a foodborne illness, though. This is something that's spread just via the air.
Correct. So many of these coronaviruses have a natural reservoir in animals. And so we know that in certain instances they've been able to infect camels or cats or bats. And the original descriptions of this new coronavirus coming out of China to a food market where they had live animals that they would sell. So the hypothesis is that there may be an animal reservoir that has now transferred into humans.
So there has been at least one case here in the U.S., someone that had traveled to that area of China. What is your message to people here? I mean, how concerned do people need to be about this virus?
So maybe I'll turn to Dr. Lawler, who's our expert on global health security, and he might be appropriate to answer that question.
So I think right now the risk in the United States and in most countries outside of China is very low. The outbreak really seems to be concentrated in the city of Wuhan, which is in kind of central eastern China. And in the U.S., we should probably be much more worried about influenza and respiratory diseases that we know cause significant morbidity and mortality every year. So on an average year, 30,000 Americans die of influenza. So we've had one detected case of this new coronavirus in the U.S. So I think it's appropriate for folks to temper their alarm. But it is, I think, reason to be aware that we are vulnerable to emerging infections anywhere in the world. With modern transportation, you can be anywhere in the globe in 24 hours. And so, I think the good thing is it highlights that we've become much better at detecting, these types of events. Our surveillance is much better than it was even in 2003 with SARS. And I think the fact that just a couple of weeks into the outbreak, we have a much better idea of what the pathogen is. We have systems already in place that are doing surveillance and detection and tracking, and so I think we're well ahead of where we have been with previous outbreaks. But again, this is unfortunately something that's going to continue to happen. New and emerging diseases are not going to stop anytime soon.
Can you talk a little bit about, would Nebraska Medicine have any role, the biocontainment unit, in responding to this, particularly if it continues to grow?
Angela, why don't you take that as our director of the biocontainment unit?
Sure. So yes, we definitely in the Nebraska Biocontainment Unit follow this and any other outbreak going on in the world very closely. And I do feel like that in our role as a biocontainment unit and also as one of the leaders in the United States in biocontainment, that we should not only be monitoring this closely but also serving as an example for others as far as doing appropriate travel screening here at Nebraska Medicine, making sure that when people come to our emergency department or our clinics that we're asking that question, have you traveled somewhere outside the United States? Not necessarily just for this virus that we're discussing, but for other pathogens as well. There are other outbreaks going on in the world as well. But yes, in the biocontainment unit, I do feel like that we should serve in that leadership role and to provide that guidance for others in their infection control management of these type of pathogens.
You talked a little bit about the change in response to these kinds of illnesses as compared to SARS 15 years ago, I suppose. Can you expand on that a little bit and talk about what the global response looks like in terms of containing this type of outbreak and treating it if that's something that's occurring?
Sure. I think overall this response has been much quicker and much more open and transparent than what happened in 2003 with SARS. So SARS was going on, and there were cases that were popping up in hospitals, and transmission was occurring for months before anybody really became aware of it outside of the local endemic region. And then it took quite a while to identify what the virus was and to implement appropriate travel screening and precautions. And by that time, the virus had escaped and was in Hong Kong, was in Singapore, was in Vietnam, ended up in Canada. And so you really had a worldwide outbreak at that point. Hopefully, so far, we seem to have done a much better job of identifying cases and implementing the appropriate public health measures to prevent spread. As I mentioned, the Chinese government has actually been very transparent and open about sharing the status of the outbreak, and identified and notified partners in the World Health Organization very quickly. The WHO is apparently meeting to discuss whether this should be declared a public health emergency of international consequence. I think at this point, most experts predict that will not happen, that the WHO will be satisfied with the status of response right now, and the fact that this appears to be, so far, relatively confined, except for a few cases that have kind of gotten out on airplanes. And so I think overall it does demonstrate that the world has made significant progress in combating these types of emerging disease threats.
And if I could elaborate just a little bit on that, clearly here in the United States we're being very proactive. So travelers from Wuhan, China are actually being funneled into 5 airports in the U.S. now, where they are being screened for any kind of respiratory or febrile illness. If they were discovered, they would be observed carefully and quarantined. Similarly, they're being given information that if they arrive here and then become ill, that they should seek a medical attention, and obviously alert medical personnel that they've been potentially exposed in Wuhan. So we're very much ahead of the ball game as opposed to where we were years ago, and are being very proactive with this. Here at Nebraska Medicine, as Dr. Hewlett mentioned, we clearly have already put in travel screening for people coming into our clinics and emergency department. We have the biocontainment unit on alert if we needed them.
One question that we've heard on staff here is people locally have had children or friends or known people who have been diagnosed with coronavirus, and it's confusing to them. They hear the word and they think it's the same thing. Can you explain the differences there?
Yeah, so clearly the coronaviruses are a large family of viruses that cause everything from the common cold, which is what you're referring to more severe lower respiratory tract disease, which is what these newer novel coronaviruses are sometimes associated with. We're particularly concerned with these novel coronaviruses and other coronaviruses sometimes in very immunosuppressed hosts. And so sometimes they can cause more severe disease, even the more common coronaviruses, in our bone marrow transplant patients or somebody who is immunosuppressed, or the very young or the very old. So we do have a wealth of experience with coronaviruses in general, and are learning more about this new one as days go by.
The biocontainment unit is ready. I mean, would someone with a very severe case of this particular strain of the coronavirus potentially come to the biocontainment unit for treatment or quarantine?
There's a chance that could happen. We, as Dr. Brutt mentioned, we are travel screening, and if we did have a person who presented to our emergency department or to our clinics that had an appropriate travel history and also appropriate symptoms, then we would consider bringing them into the biocontainment unit, mainly for diagnosis and then appropriate monitoring and supportive care. We do serve as a leader both in our region and the United States. There's a chance that if there were a patient that were infected with this illness in our region as well, that we could care for them in the unit also. And we do stand ready for this and any other pathogen.
Last question I think I have is, I know that we don't want to be alarmist because the flu is a larger threat for people here in the U.S., but if people have travel plans to go to some of these locations where the disease has been detected, I mean, what are the symptoms or what should people be aware of? Is there any sort of message of what people should be looking out for?
So the CDC has issued a fairly low-level alert for people traveling to that specific part of China that they should be careful, avoid sick people, just some common sense sort of precautions. Again, the coronaviruses generally cause kind of a febrile flu-like illness, and so it could be easily confused with much more common viruses that we're seeing. And as Dr. Lawler mentioned, I think that it's important for viewers to keep this in perspective, that we currently have widely circulating a virus, influenza, that causes anywhere from 25,000 to 50,000 deaths per year in our country every year. And so we need to be, making sure that we're taking appropriate precautions to prevent the spread of those viruses while being on lookout for this novel coronavirus at the same time.
I have a question from a reporter online asking how, if we are currently working with the CDC and WHO and monitoring or preparing for the coronavirus, does the Global Center for Health Security play a role?
Sure. So the Global Center for Health Security is involved in long-standing programs to help train first responders and other healthcare workers in appropriate infection prevention and control. We work very closely with our biocontainment unit colleagues and also with folks here at the university and at the hospital who are part of the Ebola Treatment and Education Center, which is the main resource for training hospitals across the nation in appropriate infection prevention and control. And so, all of those efforts together really over years have done a significant amount to increase preparedness in hospitals to manage these types of highly dangerous pathogens. That's another advantage that we have over 2003 is that after Ebola and with the advent of NETEC and other efforts, we've done a much better job of preparing hospitals to manage patients with potentially highly infectious diseases, and that's a real resource that I think could be relied on and will significantly improve our ability to manage an outbreak beyond 1 or 2 patients if that's what occurs.
How is something like this different than an Ebola type situation where you have such high levels of travel as compared to not seeing that as much in Western Africa with Ebola?
Well, China is a very common travel destination, both for business travelers as well as for people going on vacation, and so we don't see quite as much travel to those areas affected by Ebola in the Democratic Republic of Congo, namely currently, as we do to China, which is a very common travel destination. So that is one difference about Ebola versus this outbreak is that there are a lot more travelers returning to the U.S. and to other places from China than from the affected area in the Congo.
The other thing I would point out is that the lethality of these diseases differ very markedly, with Ebola being associated with a much higher rate of fatality than the coronavirus infection. Currently, we have a handful of deaths due to coronavirus in China. It appears to be less transmissible and less severe, perhaps, than SARS or even MERS. So we have that to our advantage as well.
Is there a way to compare how transmissible this might be compared to the flu that we're experiencing, and how lethal it might be compared to flu? We've had several deaths in the area via flu already.
Correct, and that's why I think that it's so important for people to keep those things in perspective, that we're dealing with very minimal risk right now from this coronavirus, where we're dealing with a much higher level of risk from very common viruses that we are used to encountering each and every year.
Anyone have anything else? Okay, great. Thank you, folks.
Thank you.
We are hearing of a virus, and we know of it, that has taken the globe by storm at this moment. This coronavirus. May Allah grant us cure. May He grant us protection. May He cure all those who are affected. And may He make it a test and not a punishment. Ameen. My brothers and sisters, we must make sure that we have done whatever is in our capacity to protect ourselves, to be able to immunize ourselves by the simplest method, and that is prevention. Try your best. Make sure your surroundings are clean. Make sure what you touch is clean. Your hands are clean. Make sure you are in a clean environment. If need be, perhaps in certain countries, they would put on a mask in order to ensure that the air is somewhat filtered. All this is a duty that you have if push comes to shove. We are thankful in this country that we have not yet heard of any of such cases. But trust me, we're not immune to this. It can happen. May Allah subhanahu wa ta'ala safeguard all of us. However, my brothers and sisters, whenever we are failing in health, we always seem to visit the doctor, and we should and we must. And it's a duty to visit the doctor, to find out what's wrong with you. There will be diagnosis, there will be so many perhaps tests that the doctor might send you for. And you know what? People are always anxious as they await results, especially when they are not doing well at all. Very anxious. Do not remove Allah from that equation, my brothers and sisters. Remember, the doctors are there to help indeed, and we pray for them. But at the same time, if it's not for the help of Allah, Allah may decide not to show them exactly what's wrong with you. And yet, the favor of Allah is that the diagnosis would be correct and the medication would also be correct. So we can never remove Allah subhanahu wa ta'ala from the equation. Always make a dua to Allah. Ibrahim alayhi salam, when he declared his faith in Allah subhanahu wa ta'ala, he clearly said, وَإِذَا مَرِضْتُ فَهُوَ يَشْفِينَ. Whenever I get sick, it is He, Allah alone, who grants me cure. That does not mean you should just sit back and say, well, I'm sick, Allah will give me cure, and you don't do anything about it. Allah gave you the brains, the capacity, Allah gave you the knowledge of medicine, or your neighbor or someone in your city or your town might have knowledge of medicine, thereby called a doctor, and therefore you need to go to them to find out what's wrong with you, etc., etc. All that is part of the plan of the Almighty. You cannot just sit back and say, don't worry, it's the decree of Allah. If I'm meant to be cured, I will be cured. Well, probably it was meant that you were supposed to die, so you would die out of your foolishness. May Allah subhanahu wa ta'ala protect us. My brothers and sisters, when a person is told that he is sick or ill or has a specific disease or sickness, it is our duty to pray for the person. Hence, we say right here, right now, may Allah grant cure to all those who are sick and ill in any way across the globe. Ameen. My brothers and sisters, it is our duty to feel for our fellow human beings. It is our duty to feel for the members of the Ummah. It is our duty to reach out to them when they are not doing well. Minimum by praying for them, by asking Allah to grant them cure. Trust me, you don't know the power of that prayer is such that if you were to ask Allah to give cure to a sick person, the angels would be asking for good health for you as a result. You didn't lose anything. You might be healthy right now simply because you prayed for someone who was sick and ill, and the angel said, oh Allah, give this person similar good health. Wow, isn't it a bonus? So think about it, my brothers and sisters. You would never lose anything by praying for others. May Allah subhanahu wa ta'ala grant us all good health. Once again, those who are sick and ill in any way whatsoever, may Allah grant them cure. Ameen. That having been said, we should be visiting those who are sick and ill as a duty, my brothers and sisters. This beautiful duty is that which is placed on our shoulders in order not to burden them, but to pray for them, to be showing that solidarity with them. When people are ill, generally they go to the hospital. That is the trend and that is the norm in our place and in most places across the globe. The idea is to be receiving medicine and at the same time to have a rest for a moment. So remember, when going to visit, stick to the visiting hours at least. Go for a bare minimum. Many times people are sick and ill. We go to visit them in a way that we make them more sick and more ill because we are sitting there for 2-3 hours and they don't have the courage to tell us, please leave, I want to rest or something of that nature. Therefore, remember, when you go to visit the sick and the ill, make sure that you know the timing. You know when to go and how long to go for and whether to go or not. Sometimes people are too ill to want to meet anyone, and here you are knocking at the door. They are busy praying that you leave, and one wonders what you are busy saying. May Allah subhanahu wa ta'ala grant us cure and grant us all that sensible mind to be able to do that which is correct. My brothers, my sisters, usually when we are sick and ill, we draw closer to Allah, especially when it's prolonging, especially when it's taking long. I want to tell you today, any sickness and any illness that brought you closer to Allah was actually a gift of Allah. It was not a punishment, nor was it the anger of Allah. Remember that. If you were sick and ill, and as a result, you came closer to Allah, you called out to Him, you prayed better, you got up for tahajjud, you started doing things in a good way. Don't let anyone ever convince you that that was a punishment of Allah. How can something that brings you closer to Allah ever be the punishment of Allah? It was the mercy of Allah. If it took a serious disease to bring you back to Allah, surely that was cheap, because you would now enter Jannatul Firdaus with a good connection with Allah, rather than be a person who was healthy but far from Allah. Which one is in greater favor? My brothers, my sisters, it's a point to ponder. Think about it. In fact, any calamity, any problem, any accident, any negativity according to you, if it brought you closer to Allah even 1 inch, wallahi, thumma wallah, it was a gift of Allah for you. It was a gift. He brought you closer to Him. Yes, it was, subhanallah, something you might have not liked, but it brought you closer to Allah, didn't it? If you lost your life, thereafter, wouldn't you have been closer to Allah? And this is why sometimes man is so weak that when he is cured again, he goes back to his old ways and habits. People leave the clubs, they leave gambling, they leave adultery, they leave intoxicants, they leave pornography because they are sick and ill. They come for salah, they do their tahajjud, they dress appropriately, they become better Muslims, and they cry to Allah. And they say similar to what the Pharaoh's people said at the time of the Prophet Musa alayhi salam. لَإِن كَشَفْتَ عَنَّا الرِّجْزَ لَنُؤْمِنَنَّ لَكَ. Subhanallah. They said at that time, when the plagues plagued them, they said, you know what, if you were to call out to your Lord and we were to be cured, we'll follow you, or we will actually believe in what you've brought. When they were cured, they ran away, they walked away. Don't be from among those whom, after they are cured, they turn away from Allah once again. Don't let that happen. My brothers, my sisters, it's not worth it. Would you like to get sick again for Allah to bring you closer to Him? And I tell you something else. When we are granted cure, consider it a bigger favor of Allah. Let your life change. Let something change in you. Become a better person. Become conscious of those around you. And prepare for the day when you might not be cured. When you might go back to Allah without even being sick. How many people today pass away? They were not sick. Suddenly, heart attack. Suddenly, an accident. Suddenly, they contracted something, and within moments or days, they were gone. It's happening, my brothers and sisters. It can happen to me. It can happen to you. Just prepare for the day. Don't become depressed. You have to go back to Allah. There's no way that you cannot. You have to go back to Allah. There's no chance. There's no option. There's nothing besides that. You must return to Allah. Guess what? The good news. Allah is loving. He is kind. He is forgiving. Not just forgiving, the most forgiving, the most merciful. It only requires that you change. Now, I wish to address a very important matter. When you are diagnosed with a terminal illness, what do you do? I'm a mu'min. May Allah safeguard all of us. From amongst us, there may be some diagnosed cancer, suddenly HIV, AIDS, something else, suddenly contracted the coronavirus. May Allah protect us all. And like I said, again, may Allah give shifa to all those who are affected across the globe, no matter who they are. And may He bring them closer to Him as a result. My brothers and sisters, if you have been diagnosed with a terminal sickness, if you are terminally ill, suddenly you found out, you know what? This is cancer. Cancer can be cured. Subhanallah. Many people lose their lives, but remember, the cures are always on earth. It's just that we haven't found a way to some of them. May Allah subhanahu wa ta'ala grant us cure.
Good afternoon, everyone. I want to start today by acknowledging that even though COVID-19 has captured the world's attention, there are still many other health issues people continue to face every single day, and that WHO is continuing to work on. Babies are still being born. Essential surgery is continuing. People still need emergency care after road traffic crashes. People still need treatment for cancer, diabetes, HIV, malaria, and many other diseases. And for all of this, we need health workers. Today, I want to send a personal and sincere thank you to every health worker around the world, especially nurses and midwives, who we are celebrating this year through the International Year of the Nurse and the Midwife. You do a heroic job. We know that this crisis is putting a huge burden on you and your families. We know you're stretched to the limit. You have our admiration, our respect, and our commitment to doing everything we can to keep you safe and enable you to do your job. More than 132,000 cases of COVID-19 have now been reported to WHO from 123 countries and territories. 5,000 people have lost their lives, a tragic milestone. Europe has now become the epicenter of the pandemic, with more reported cases and deaths than the rest of the world combined, apart from China. More cases are now being reported every day than were reported in China at the highest of its epidemic. At the height of its epidemic. I will repeat this one. More cases are now being reported every day than were reported in China at the height of its epidemic. We're encouraged that many countries are now acting on the 8 pillars of WHO's strategic preparedness and response plan. Most countries now have a national plan. Most are taking a multi-sectoral approach, and most have laboratory testing capacity. WHO has evidence-based guidance that every country can use according to each of the 8 pillars. And we're continuing to support countries to prepare and respond. We have shipped supplies of personal protective equipment to 56 countries, and we're shipping to a further 28 countries. And we have sent almost 1.5 million diagnostic tests to 120 countries. Our message to countries continues to be, you must take a comprehensive approach. Not testing alone, not contact tracing alone, not quarantine alone, not social distancing alone. Do it all. Any country that looks at the experience of other countries with large epidemics and thinks that won't happen to us is making a deadly mistake. It can happen to any country. The experience of China, the Republic of Korea, Singapore, and others clearly demonstrates that aggressive testing and contact tracing combined with social distancing measures and community mobilization can prevent infections and save lives. Japan is also demonstrating that a whole-of-government approach led by Prime Minister Abe himself, supported by in-depth investigation of clusters, is a critical step in reducing transmission. WHO has clear advice for governments, businesses, and individuals. First, prepare and be ready. Every person must know the signs and symptoms and how to protect themselves and others. Every health worker should be able to recognize this disease, provide care, and know what to do with their patients. Every health facility should be ready to cope with large numbers of patients and ensure the safety of staff and patients. Second, detect, protect, and treat. You can fight a virus. You can't fight a virus if you don't know where it is. Find, isolate, test, and treat every case to break the chains of transmission. Every case we find and treat limits the expansion of the disease. Third, reduce transmission. Do not just let this fire burn. Isolate the sick and quarantine their contacts. In addition, measures that increase social distancing, such as canceling sporting events, may help to reduce transmission. These measures, of course, should be based on local context and risk assessment and should be time limited. Even if you cannot stop transmission, you can slow it down and save lives. And fourth, innovate and learn. This is a new virus and a new situation. We're all learning, and we must all find new ways to prevent infections, save lives, and minimize impact. All countries have lessons to share. There are simple, effective things we can all do to reduce the risk of infection for ourselves and those around us. Clean your hands regularly with an alcohol-based rag or soap and water. Cover your mouth and nose with your elbow if you cough or sneeze. Stay home if you're sick. Avoid unnecessary travel and large social gatherings. Comply with the advice of your local or national health authority. Find and share reliable information. And finally, you can give. Together with the United Nations Foundation and the Swiss Philanthropy Foundation, WHO is today launching the COVID-19 Solidarity Response Fund to enable individuals and organizations to contribute. Until now, we have been relying mainly on governments to support the response. We thank all those countries who have supported WHO's strategic preparedness and response plan, including Japan, which this week contributed $155 million. Now everyone can contribute. Funds raised will be used to coordinate the response, to buy masks, gloves, gowns, and goggles for health workers, to buy diagnostic tests, to improve surveillance, and to invest in research and development. To give to the COVID-19 Solidarity Response Fund, go to who.int and look for the orange Donate button at the top of the page. We thank Google, Facebook, and the individuals who have already contributed. Every dollar donated is a dollar toward saving lives. We're all in this together. I thank you.
Thank you very much, Dr. Tedros. As we speak, the press release on the launch of COVID-19 Solidarity Response Fund is being sent to you. Just to remind everyone that this press briefing is being broadcast on various platforms from our sites, WHO Facebook, WHO Twitter account, WHO YouTube channel, as well as on LinkedIn. So we will start with the questions from journalists who are listening us, who have either dialed in or who are watching us through Zoom. So we will start with Anjali from Yahoo Finance.
Can you hear me?
Yes, please go ahead.
Great, thanks so much. I just wanted to know, in terms of the social distancing techniques that are being used and implemented, there's been some criticisms of them being, put in place.
I can
so
indeed.
I just
Can you
wanted
hear
to
me?
know, really,
Yes,
right
please go
now, how do
Great,
we
thanks
see,
so
how do we
much.
view that?
I just wanted
as
to know, in
opposed
terms
to,
of the
the
social
testing, 'cause we know that
distancing
in the US
techniques
there's
that are
been
being
some
used and
issues over that.
implemented, there's been
Yes, I mean, social distancing is a tried and tested method in slowing down the pace of epidemic spread, and certainly in the cases of previous influenza pandemics, social distancing has been used to some effect in slowing down the spread. Social distancing is based on a principle that you don't know who's infected and you're separating, putting social distance between everyone. We've said again and again, many countries are not in that situation yet. Many countries are in a situation where the disease is recognizable, cases can be detected, contacts can be identified, quarantined, and it is a more cost-effective intervention to separate some individuals from society than separate everybody in society from each other. However, where there is not a good handle, where there hasn't been a good understanding of disease transmission, where enough has not been invested in core public health interventions such as case finding and contact tracing, then social distancing measures may be your only option to create distance between individuals. But as we've said in previous press conferences, they are very costly interventions in terms of societal acceptance. They're very costly in economic terms, and they have to be used in a time-limited fashion with the specific purpose of slowing down infection enough to protect the health system. And I think this is the difference. Very often in public health, we use case finding and contact tracing to go after the virus, to stop, to interrupt, to push back. That's the purpose of those public measures. The purpose of social distancing is only to slightly slow down the virus so your health system can cope. The objectives are different. And I think we have to be clear that social distancing measures are not a panacea. Social distancing measures are not going to stop this epidemic. They're not going to stop this pandemic purely in their own right. And if countries want to really turn this around, for those countries that are in a position to do that, and it's been clearly demonstrated in other places, then investing back in a measured, comprehensive strategy, as Dr. Tedros has referred to it so many times, of trying to still do the kind of case finding, contact tracing, isolation to push the virus back. That is not to say that certain social distancing measures will not have a positive impact, but they come at a cost and must be considered, as Dr. Tedros has said, in the local context. And there's a local context that is both in public health terms, but also in societal acceptance terms. A society may accept social distancing in one part of the world and they may reject it in another. And governments have to balance those genuine dilemmas around social and community acceptance.
And if I can just complement that, so in addition to what Mike has said, he mentioned this comprehensive package of measures, and the DG has said this repeatedly. So social distancing is one aspect that we have been promoting here, but this is in addition to a lot of other measures that we have also been promoting, which include case and contact finding, aggressive case and contact finding, and testing. Testing needs to be appropriate in each country to ensure that we know who are cases and who are not cases. It also includes hand hygiene, washing your hands with soap and water, using an alcohol-based rub, making sure that you also practice respiratory etiquette. You are sneezing into your elbow or coughing into your elbow. Making sure that we mobilize all of our population. It is very important that every single person on the planet knows what the signs and symptoms of COVID-19 are. The signs and symptoms of COVID-19 is not sneezing and having a runny nose. It's a fever. It's a dry cough. It's aches and pains. It's very important that we know those differences. Some people will also have difficulty breathing. And so knowing what the signs and symptoms are, knowing what your risk may be, will help protect you and help protect your family.
Thank you very much. Just to remind journalists to ask one question at the time. So let's try now with Banjo Kaur from down third from India. Banjo, can you hear us?
Thank you very much. Just to remind journalists to ask one question at a time. So,
can you hear me?
Yes, we can hear you now. Please go ahead. With Banjo Kaur from down
my question is,
India. Banjo,
India
can you
has
hear us?
blocked the travel for all foreign nationals coming from across the globe.
Hello?
Does WHO think, can you hear me? Its own assessment.
Yes, we can hear you now. Please go ahead.
My question is, India has blocked the travel for all foreign nationals.
Consistently said that each sovereign country must decide upon its own measures to protect its population. But we've also consistently said is that blanket travel measures in their own right will do nothing to protect an individual state. In fact, many countries who had outright travel bans early in this response ended up importing cases anyway, and may have reacted later than they should have because they assumed travel restrictions would protect them. So I think it's very important that the main focus in this fight is not on anything other than the public health measures, case detection, isolation, getting increasing number of tests done. People who know their status can protect others. It's a little bit like in the HIV epidemic. Until people could understand my status, if I know that I'm infected, I can protect others. So we need to move to that sort of a stance, and investing in the capacity to do that, investing in the ability to treat cases effectively and give proper reassurance in community education, in community mobilization. As part of an overall comprehensive strategy, there is a place, particularly inside national borders, for potentially restricting movement between zones, as we've seen in certain places. But there is rarely justification for blanket bans, unless, of course, the context and the risk defines that. So it's difficult for us to comment on the individual action of an individual nation. We would have to fully understand the risk assessment and the vulnerability assessment that was carried out in India.
Thank you very much. So let's try to get to NHK now. If we have someone, otherwise NPR, sorry, and then we will get to NHK after that. Do we have anyone from NPR?
Yeah, hi, this is Ping. Can you hear me?
Yes, please, go ahead.
Hi, this is Ping Huang from National Public Radio. I wanted to ask about stigma. So Dr. Jesus has said that stigma is more dangerous than the disease itself. And
do we have anyone from NPR?
Yeah, hi, this is Ping. And are there actually any examples of leaders that are doing it right? Hi.
I think there's something everyone can do to battle against stigma. You know, to educate yourself about what this virus is, where it's circulating. No one is at fault for getting infected with this virus. We need to help each other as best we can. We see many examples of countries helping each other within their own populations, whether this is providing some support to families who have infected cases, providing support to families who have members who are in quarantine, providing support to healthcare workers who are working on the front line, bringing them groceries or helping them clean their homes. And we need to all stand up to stigma. We need to stand up to people who are pointing out that someone may be at fault for being from a certain country. This absolutely should not be tolerated in any form. And we do see many good examples of it, and we need to make sure that we promote that. But everyone has a responsibility here to do the right thing and to help each other out during this difficult time.
Mm-hmm. If I could add, because there's another word that goes with stigma, and that is exclusion. And there are two processes here. One is, as Maria has very well explained, the issue of stigma associated with the disease or profiling according to that. But there's also something we need to avoid. We've been speaking very much about those who are vulnerable in our societies. And that vulnerability is very important to deal with. But when we speak about that vulnerability, we cannot forget migrants. We cannot forget undocumented workers. We cannot forget prisoners in prisons. They may be serving sentence, but they deserve no less protection under the law than others. So when we talk about stigma, we also need to really look carefully at exclusion. We're working very closely with the Office of the High Commissioner for Human Rights, with the Red Cross movement. We were on the telephone this morning. We've been speaking about joint activities around issues like this. The Director General has said many times, we must leave no one behind, because the only way to beat this is to leave no one behind. So when we talk about stigma, we also need to avoid that, but we need to avoid exclusion as well. We're in this together, and I hope we can finish this together.
Yes. I fully agree, and this is everyone's business, and nobody should be excluded. But the only thing I'd like to add to this is, especially political leaders, religious leaders, community leaders have a special role to play here, to bridge and also to tell our followers to adhere to just basic morality, respecting others. And this virus is a common enemy. So I would expect and call upon all political leaders, religious leaders, and community leaders to play a bigger role here.
Thank you very much. Let's try to move to Karachi in Pakistan. Express Tribune. Do we have someone online? Hello, can you hear us, please? Yes, yes, please, go ahead. Hello, we can. Yes, we can hear you.
Hi, I'm Neha.
Yes, we can hear you. Please go ahead.
Hi, I'm Neha from the Express Tribune.
Okay, welcome, please.
My question is, what does the epidemiological outlook in Pakistan look like in the near future?
Thank you very much.
It's difficult to predict the epidemiologic outlook in any country. I have personally worked in Pakistan on polio eradication for nearly 3 years, and very much enjoyed my time working with some excellent Pakistani colleagues working on infectious disease control, among them Dr. Rana Safdar. So I think there's a great capacity in Pakistan. There's a great public health capacity, but there are also great challenges. You have a highly mobile population, you have great mega cities, and you have many underserved people. So there is a great challenge facing Pakistan. But Pakistan has also demonstrated time and time again with dengue, with polio, with other diseases, how all of government, all of society approaches can be made to work. So we wish Pakistan all the best luck in the world, and all of our assistance in supporting some fine public health servants in your country.
Thank you very much. Hope this answers a question on Pakistan. Now we go to Moscow, to Comexant FM, and we have Uliana calling. Uliana, can you hear us?
Yep. Can you hear me?
Yes, please go ahead.
Well, my questions are, when do you think the COVID-19 will peak in the world? And given that the vaccine has not yet been developed, does WHO have any recommendations about drugs or medications that can be effective in the treatment process?
Thank you very much.
So the first question is, when will this peak in the world? That's a very good question, and I'm sure everyone has that on their mind. One thing we are not able to do is to predict what will happen. What we need to do is prepare for any scenario. And the trajectory of this pandemic, the trajectory of each epidemic in each country is dependent on the actions of each country. So what we have seen in several countries in Asia, we've seen them tackle this virus, be aggressive in their approach in terms of finding their cases and contacts, and have this comprehensive approach that we've discussed previously, mobilizing their workforce, having an all-of-government, all-of-society approach. We've seen them turn the corner. So we've seen them have very strong, very bad epidemics and have them peak. Hopefully that they've peaked. China has certainly peaked and there's been a decline, but there's always the chance that those cases can increase again. So we always have to be on the ready to look for any cases that pop up. With regards to the rest of the world, as I said, it will depend on how countries react to their first cases and if they have an aggressive approach to those first cases. For countries that are dealing with clusters of cases, it will depend on how they aggressively look for the chains of transmission within those clusterings of cases, making sure that they identify every single case, every contact, separate the contacts, put them in quarantine. And for those countries that are dealing with much larger outbreaks and community transmission, making sure that there's a much broader approach in terms of mobilizing their entire workforce to support the response to this, making sure that their hospitals have the possibility to cope with increasing numbers of cases. But it's impossible for us to say when this will peak globally. We hope that it is sooner rather than later, but again, we can't emphasize enough that there have been countries that have demonstrated the ability to turn the tide to suppress transmission. And it is in the hands of every country to be able to do that. So we are hoping that more countries put more aggressive efforts into doing so.
On the issue of drugs and vaccines, there's been there are a large number of trials underway of therapeutic options, and we will speak in more detail early next week. We are very excited with the level of solidarity and cooperation going on between member states, between scientific institutions, who are putting together a global platform for being able to carry out these trials together, using the same approaches, using the same protocols, and sharing that data, and being able to have a much more powerful opportunity to identify effective therapies. We will speak in much more detail on that next week. Equally, on the vaccine side, we're working extremely closely with CEPI, but also with Gavi and other institutions, and there is a major funding gap on that side as well. It's not just for the operational response and supporting countries with weaker health systems. We have to move now to manage the risks and make the investments we need to develop vaccines going into the future. And we're working very closely with our colleagues in CEPI on that. And the fund that's been launched today will cover many aspects of that, including investments in vaccine development through partner institutions like CEPI.
Thank you very much. I will read one question that I received through SMS from DPA, German news agency, our friend Christian Ulrich, who is asking for Dr. Tedros, but maybe also for Mike, what are the biggest lessons the world can learn from Ebola outbreak in Congo in fighting the epidemic?
It's difficult. Sometimes we over-extrapolate from one event to the other, and sometimes we don't learn enough lessons and we don't adapt enough. I think what we've learned in Ebola outbreaks is you need to react quickly. You need to go after the virus. You need to stop the chains of transmission. You need to engage with communities very deeply. Community acceptance is hugely important. You need to be coordinated. You need to be coherent. You need to look at the other sectoral impacts, the schools and security and economic. So it's essentially many of those same lessons. But the lessons I've learned after so many Ebola outbreaks in my career are: be fast, have no regrets. You must be the first mover. The virus will always get you if you don't move quickly. And you need to be prepared. And I say this, one of the great things in emergency response, and anyone who's involved in emergency response will know this, if you need to be right before you move, you will never win. Perfection is the enemy of the good when it comes to emergency management. Speed trumps perfection. And the problem in society we have at the moment is everyone is afraid of making a mistake. Everyone is afraid of the consequence of error. But the greatest error is not to move. The greatest error is to be paralyzed by the fear of failure. And I think that's the single biggest lesson I've learned in Ebola responses in the past.
We will move on. If we may try to get NHK this time around. NHK? NHK, can you hear us? I think it's Shoko who is online. We don't have NHK. Let's move on. Chris, can we get Jeremy, maybe, who was online for some time now? Jeremy from Radio France International. And I would also, while we are waiting to get a journalist online, just to remind you that we have announced the launch of COVID-19 Solidarity Response Fund, and we have colleagues online who can speak about that. So if we should really try to use them and ask questions about the fund itself. But again, it's a press conference and journalists can ask questions they want. Do we have Jeremy online? Jeremy?
Yeah, can you hear me?
Yes, Jeremy, please go ahead.
Okay, forgive me because I have my kids right next to me, so you might hear her already. I won't try today again to ask you who's doing poorly in Europe, because I know that you don't want to talk too much about member states. But can I try and ask you who's doing good in Europe regarding containment versus mitigation measures? And then I can try to guess by myself who's doing poorly then.
Good. Yeah, I think you just answered my previous question. We are not seeking to identify those who do poorly or do well. We're trying to identify the best lessons we can all use, the best way to move forward together. No one has done perfectly, and no one has made all the mistakes. We share all of the errors together, so we will share failure in the same way we will share success. So if one person makes an error in a team, do you blame the person or the team? Are we a team at global level? We are. Are we a team at national level? We should be. Are we a team at community level? We should be. So we won't break from that. If we have tough discussions, we will have them directly with our member states and with those governments.
If I can add something, I'm not going to answer that direct question, but I want to say something that if there are countries that are starting to identify cases and starting to identify large numbers of cases because they're looking, because they're doing aggressive case and contact finding, they shouldn't be punished from that. It's really important that we support countries in doing the right measures, and sometimes that's going to mean that case numbers are going to increase. And in many countries, it's going to get worse before it gets better. And so I just urge everyone to take caution with that, and that these numbers are going to increase. So please look for cases, please do testing and find those cases, and so we can turn the tide.
Yeah. And if you want to evaluate any institution or governmental approach, ask the questions the Director General asked. Is every member of society know what to do? Does every member of society informed? Is every health worker protected? Is every health worker know this disease and knows what to do? If you can answer those questions as a government, as an institution, as a community, then you're on the right track. If you answer no to any of those questions, you're not ready, or you're not doing enough yet to be ready. So I would point you back to the text of Tedros' speech. On a more general level, we work very closely with the World Tourism Organization, with the Civil Aviation Organization, with the International Air Transport Association, and so many others in trying to come up with common guidelines and common technical inputs for all of our partners in the hospitality and travel industry. And we do feel for your industry in particular in terms of the impacts it's had on you. We thank you for your participation, your cooperation, and for the sacrifices you're making to help cope with this pandemic. And we certainly will work harder, and especially in those contexts where it is possible, to ask governments to share more risk information with your institutions.